All right. Hello, everyone. As folks are coming into the Zoom space here, I'll give a quick introduction to myself. Hi, my name is Christine. I use she, her pronouns. I am an Asian American woman with long brown hair and a braid today. I am your Zoom technical host, so if you have any issues related to access or tech, etc., I'm happy to help you with that in the chat. A couple of access notes before we get started here. There should be an ASL interpreter visible on your screen. Captions are available by pressing that CC button at the bottom of your screen or by clicking on the stream text link, which is now in the chat. This event is being recorded with the exception of the Q&A at the end, and that recording should be available to you afterwards. So if you need to leave for any reason, that's okay. We've totally got it. You'll have access to that afterwards. I urge you to put your questions in the Q&A, which is also at the bottom of your screen. So if you have any questions, just go ahead and put them there. And the chat is open. I believe there will be some parts of the presentation where our presenters are asking you to participate in the chat, so you can do it that way. If I see anybody raising their virtual hands, I'll check in with you in the chat and see if there's anything that you need. But other than that, I think I'm going to go ahead and hand it over to Brandi.
Thank you. So the Docs with Disabilities initiative is proud to welcome you to our first ever webinar from the Access and Nursing team, aligning nursing technical standards for disability and inclusion. My name is Brandi Jackson, co-chair of Access and Nursing. This webinar is intended to be an introductory discussion about technical standards, giving you the legal, regulatory, and best practice perspective with some examples of inclusion and non-inclusive standards. A more robust workshop format of this topic will occur in February, where participants will actively work to amend their technical standards and disability inclusive language. Please note today's presentation is being recorded and will be available on the Docs with Disabilities YouTube page within 10 business days. A PDF of today's presentation, an accessible Word document, and a resource handout will be available for this webinar via links from our YouTube page. You can head over to our YouTube page and subscribe to be alerted to the webinar being posted. We are pleased to offer closed captioning and ASL interpretation for today's webinar. And go ahead and click in the chat panel to access this feature. All participants' audio and video is muted. If you experience any difficulty during this webinar, please use the chat to contact our team. Presenting this information today are myself and my other co-chair, Ann Lewis, as well as Docs with Disabilities Initiative founder and co-director, Dr. Lisa Meeks. Although we will be presenting, it is critically important to recognize all the members of our Access and Nursing team who worked behind the scenes to make these training materials and thus this event possible. Megan Arbor, Yvette Conyers, Elizabeth Davis, Rachel Durr, Alyssa Gadden, Sarah Vingay, and Kathleen Tilton. As Access and Nursing creates more resources, you'll have an opportunity to meet and engage with our team of nurses and nurse faculty members dedicated to disability inclusion. And finally, we want to thank our partners at the Association on Higher Education and Disability and the American Association of Colleges of Nursing for co-sponsoring this important webinar.
Today's webinar was informed by the literature, the legal framework, and our team's collective experiences working in nursing education or disability resources for over 20 years. We'd especially like to highlight 2 articles written by luminaries and fierce advocates for disability inclusion in nursing, including Ailey and Marks and their 2017 article, Technical Standards for Nursing Education Programs in the 21st Century, and Leslie Neal Boylan and Michelle Miller and their 2020 article, How Inclusive Are We Really? You can find these references in the chat. We also drew from 2 seminal books on the topic of disability access in health professions education, including Meeks and Neil Boylan's Disability as Diversity, specifically using the chapter on technical standards from McKee, Ailey, Gay, and Meeks, and the Meeks, Jane Laird 2020 book, Equal Access, using Elise Laird's chapter on technical standards. The Equal Access book is now available for free download. Links to both books are in the chat and on the notes page in YouTube. So let's get started. By the end of our program today, we hope you will have a good overview of technical standards and be able to define technical standards, recite any legal or regulatory requirements, and understand the key elements of inclusive standards. This presentation is not intended to dictate your technical standards, provide legal guidance, or endorse the technical standards of any specific school. Think of us as colleagues offering to summarize in 45 minutes the advice that is available in the literature.
Wonderful. Thank you, Anne. So what are technical standards? Well, the term technical standards refers to the academic admission criteria that are essential for participation in a program in question. And what the technical standards are not, I think, is equally important. We want to make sure that you understand the differences between technical standards, essential functions, learning objectives, and core competencies. These are things that are often conflated. Essential functions are the fundamental job duties that employees must perform with or without reasonable accommodations, and they are specific to a position and based on the work performed and not the employee's ability. While learning outcomes are measurable statements that describe what a student should be able to do, know, or value after completing a nursing course or a nursing program. They're written for the student, and the focus is on the application of knowledge and skills. And core competencies are skills that are needed in order to be successful at a job or other activity, and they come after a specific type of training. So I hope you're seeing the differences here. Technical standards are the skills and abilities needed to enter a program, not necessarily to exit. And really importantly, and perhaps this is the largest takeaway for today, as we introduce this idea of technical standards, and later when we review some examples, we want you to pay close attention to the language and the differences between 2 key approaches. The first approach is organic, and I know we're all taught that organic is amazing, but in this case, organic is bad. So that's a whole cognitive dissonance thing you have to get over. But organic technical standards are those that focus on how a student goes about completing a skill or a competency. And some examples would be must be able to hear or see or speak clearly or stand for long periods of time in tight spaces. Hopefully none of this is sounding familiar from your technical standards. While the opposite is functional technical standards, and these focus on a student's abilities with or without the use of accommodation or assistive technologies. And some examples of the type of language that would lean on functional, and again, in this case, functional is good, organic is bad, include elicit information or communicate effectively. And so in this way, it's not saying you have to hear or speak to communicate. It's just saying you have to be able to communicate effectively.
So health professions programs often look to their association and accrediting bodies for guidance on developing policies and standards. So we did just that. And after a thorough review, here is what we found. Nothing. So when you consider the best approach to writing inclusive technical standards for nursing school, a big issue becomes readily apparent. There are no requirements from accrediting bodies regarding technical standards, thus no standardization of language or domains. Go ahead and click. This This leaves schools taking an individual approach to developing technical standards based on information gathered from sources that may not be related specific to nursing, or using guidance that is dated and doesn't account for current technology. So how did technical standards even enter our nursing lexicon? So it all started with a landmark case in 1979, Southeastern Community College versus Davis. This was the first time the U.S. Supreme Court interpreted Section 504 of the Rehabilitation Act. The case remains crucial when it comes to admitting individuals with disabilities into health professional programs. In this case, Southeastern Community College denied admission to a woman with significant hearing loss in its RN program. At the time, there were no technical standards. However, the college engaged its faculty and determined that admitting the student would require fundamental changes to its program. The Supreme Court unanimously upheld the college's decision, and this was the first time technical standards were mentioned. Lisa will say more about this later in the webinar. While the case still serves as a solid legal precedent, many legal scholars and disability advocates believe the outcome would likely be different today. Around the same time, the Association of American Medical Colleges created a special advisory panel which issued a report outlining recommendations for technical standards for medical schools in 5 key areas: observation, communication, motor skills, conceptual, integrative, and quantitative abilities, and behavioral and social skills. Most medical schools quickly adopted these standards, and many still use them in some form today. Following this, the National Council of State Boards of Nursing also published guidelines. This was around 1997. They are no longer available or considered relevant for drafting technical standards today. And though they don't offer guidance on technical standards, organizations like the American Nurses Association, the National League for Nursing, and the American Association of Colleges of Nursing have all issued statements supporting the inclusion of students and nurses with disabilities in our profession. While many nurses and nurse educators on the call will be very familiar with this concept, we want to make sure to distinguish the roles of the varied organizations for all of our attendees. Let's take a minute and review the various roles of nursing associations, regulatory bodies, and accrediting bodies. Nursing associations, such as the American Nurses Association, focus on advocacy, professional development, and support for nurses and nursing students. They don't have regulatory or accrediting authority. Regulatory bodies, such as the National Councils of State Boards of Nursing, legally enforce standards for licensure and practice, ensuring public safety by regulating who can practice nursing. Accrediting bodies, such as the Commission on Collegiate Nursing Education, are voluntary organizations that evaluate and validate the quality of nursing education programs to ensure they meet specific standards. Each plays a critical role in maintaining high standards in the nursing profession, but operates in distinct ways. Let's take a closer look at what they have to say. Although most accrediting bodies for nursing programs don't offer specific technical standards, they emphasize the importance of being non-discriminatory and transparent. Just looking at a few of these accrediting agency standards, common themes include publicly accessible policies, inclusion of admission, progression, graduation, and technology requirements, inclusive student services, fair and equitable practices. These guidelines enable programs to establish technical standards based on current evidence. We will place links to these standards in the chat. The NLN core competencies for nurse educators also offers valuable guidance. First, we must create inclusive, positive learning environments that support all students. Strong student-faculty relationships enhance the educational experience, so fostering these connections is essential. We should also implement diverse teaching strategies tailored to different student needs. Recognizing the faculty's role in accommodation process is crucial, as they provide vital support. Finally, ongoing faculty development in accommodations is necessary to equip educators with the skills to assess all students effectively. By focusing on these competencies, we can improve educational outcomes for nursing students.
Thanks, Brandi. Now you know about the history of technical standards in nursing and the roles that nursing associations and accrediting bodies play in the inclusion of students with disabilities. But I want to broaden this view for just a moment to bring in the legal perspective. With full recognition that I'm not an attorney, and again, I am not an attorney, and this webinar is not intended to offer legal advice, yet I often hear DRPs and faculty saying, the law says, or the ADA mandates. So let's peek under the hood, shall we? There are three primary federal laws that address non-discrimination of disability. And these are Section 504 of the Rehab Act of 1973. This is a law that prohibits the discrimination against qualified handicapped, and I apologize for the use of that term, that is what is written to law, persons from participating in programs that receive federal funding. And so you're often going to hear this referred to as just Section 504. And then, of course, there's the Americans with Disabilities Act. And this statute was basically adopted into the provisions of the Rehab Act and expanded to mean that we go beyond what's federally funded, and we apply them to employment and state and local government. We know this by the shorthand ADA. And then the Amendments Act of 2008. And in 2008, Congress, in an attempt to kind of right what had gone wrong and double down, if you will, on their intent to broadly interpret the law, passed the Amendments Act. And I want to let you know that they also gave very specific examples. And I'm telling you this for a reason. It's because many of our learners that are requesting accommodations have ADHD. And I just want to note that ADHD as a diagnosis with functional limitation was mentioned in the Amendments Act. So as you see an increase in ADHD, and a lot of times people will question whether this is covered under the ADA, depending on the circumstances, it definitely is. And that would be most specific to the Amendments Act, specifically naming attention and thus ADHD in the amendments. So what does the law say? Well, in terms of technical standards, it doesn't really appear anywhere in the law, none of the three federal laws that we've talked about. And it's really not defined well in the regulations of these laws either. But in 1978, so 5 years after the Section 504 language became the law, the term was referenced, but not well defined. So it was very, very deep in the regulations. And there in this very obscure place, it said, with respect to post-secondary and vocational educational services, a handicapped person, again, apologies, who meets the academic technical standards and academic and technical standards requisite to admission or participation in the recipient's educational program or activity. So you get a sense that this is it. This is kind of what the law says about technical standards. There is one other statute that surrounds non-discrimination of individuals with disabilities that could be applied to this. And so, you know, it hasn't been, but this is something that we would want you to be aware of. And this is deep again in the Code of Federal Regulations, and it says a public accommodation shall not impose or apply eligibility criteria out or that screens out or tends to screen out an individual with a disability or any class of individuals with disabilities from fully and equally enjoying any goods, facilities, privileges, advantages, accommodations, unless it's known to be or shown to be necessary for the provision of goods, services, privileges, advantages, or accommodations being offered. And I think this further underscores the necessity that your technical standards match up with your required curriculum, your evaluation methods, and any regulations that you have from your accrediting agency. Because if you don't do that, if you just have these standards to get in and they're not tethered to something in your curriculum or as an outcome or a regulatory or accreditation requirement, then what happens is you run the risk of unnecessarily screening out people with disabilities.
Thanks so much, Lisa. So far, we've established the history and importance of inclusive technical standards, as well as the support from accrediting bodies for non-discriminatory and readily accessible policies. But how do you use this information at your own institution? Let's start by discussing some best practices to writing inclusive technical standards. So what are the elements that are essential to increase the inclusive nature of your technical standards? Information about the process may look different for different groups, but at a minimum, technical standards should contain these fundamental elements. A statement that encourages matriculants to disclose disability and request accommodation, a statement that communicates a confidential process, and a statement that directs students to the Office for Disability Resources. Programs should ensure through their technical standards that applicants and matriculated students understand the process for requesting accommodations. It should be clear to the current and prospective student that the program encourages disclosure of disability, requests for accommodation, and maintains a commitment to students with disabilities. By proactively communicating a commitment to prospective and current students with disabilities, programs can reduce stigma and increase opportunities to ensure learner access. So let's take a look at some introductory language. This slide reads, "The knowledge, skills, and abilities required to safely and effectively practice nursing are varied and complex. The National Council has defined the following functional abilities that a nurse must possess to practice safely and effectively. To ensure that your decision to pursue a career in nursing is the correct one for you, we ask that you review them. They are the non-academic requirements of the program, and they comprise physical, emotional, and professional demands required of a nurse. Take into consideration whether you can perform the following functions with or without accommodations. If you determine that you are unable to do any of the skills listed and you have a documented disability, you will then need to determine if a reasonable accommodation can be provided. Throughout your educational program, you will find yourself in a variety of learning experiences. You will need to take into consideration the specifics of each position and the percentage of time the skill will be needed in order to determine if reasonable accommodations can be provided. To request an accommodation, you will need to contact the Disabilities Service Office and present documentation of your disability." So in the chat, tell us how this makes you feel. Post the first words or feelings that come up for you. So I'm seeing great comments, everyone. I'm seeing excluded, unable, unwelcoming, overwhelmed, also seeing helpful, unclear, a burden, confused. These are really good reactions and ones that our team would agree with. So the overall tone of this example is that students with disabilities may not have the skills necessary to complete this program and may not be able to have their disability-related needs met. It also gives the impression that the responsibility for accommodation lies solely with the student, when in reality, it is the responsibility of the student to connect with campus disability services and the institution's responsibility to determine and provide accommodations.
Okay, let's contrast what Anne just showed you with the tone and language of the following example. Before, as you did before, as I'm reading along, please go ahead and enter stuff in the chat. And I was just looking at the chat and I'm overwhelmed. First of all, thank you so much for crowdsourcing and sharing your feelings. I love this. So this is an example of welcoming language. Blank University is committed to diversity and to attracting and educating students who will make the population of healthcare professionals representative of the national population. Our core values, I care, innovation, collaboration, accountability, respect, and excellence, translate into our work with all students, including those with disabilities. X University actively collaborates with students to develop innovative ways to ensure accessibility and creates a respectful, accountable culture through our confidential and specialized disability support. X is committed to excellence in accessibility, and we encourage students with disabilities to disclose and seek accommodations. X University College of Nursing provides sample description examples of technical standards to inform incoming and enrolled students of the performance abilities and characteristics that are necessary to successfully complete the requirements of nursing curriculum and provide effective and safe healthcare. To matriculate, to enroll, the student must meet technical standards with or without reasonable accommodations and maintain satisfactory demonstration of the standards for progression through the program. So how do you feel? What does this feel like to you? This is great. And we will in our links on the YouTube page, we have a whole resource bundle. It's huge that we are sharing with you. So it will have copies of book chapters and all of the resources that we've shared today in a Word document. So no worries. But in this example, the school makes it clear that students with disabilities are welcome by talking about their dedication to accessibility and encouraging students to seek accommodations. All right, now let's look at another example of welcoming language. And we're looking at this example because it specifically talks about technical standards not being something to dissuade individuals. So this exemplar reads, name of program maintains a strong institutional commitment to equal educational opportunities for qualified students with disabilities who apply for admission to blank or who are already enrolled. The technical standards are not intended to deter a candidate for whom reasonable accommodation will allow the fulfillment of the complete curriculum. Admitted candidates with disabilities are confidentially reviewed by and then the name of the officer to determine whether there are reasonable accommodations or alternative mechanisms that would permit the candidate to satisfy the standards. This process is informed by the knowledge that students with varied types of disability have the ability to become successful health professionals. Oh, that's like so bucket filling and heartwarming. Every time I read this example, I think, good on you to the school. If you are an applicant with a disability who may require an accommodation for our program, we encourage you to contact, and then it gives a person's name, not just this generic email, but a person's name. And it specifically says this is a confidential consultation. So what could be more heartwarming than that? All right, we're going to start with some examples.
Thank you, Lisa and Anne. So let's take a look at some examples from the real world, technical standards by domain. These examples were pulled from current nursing programs within the last 2 weeks. This slide reads, communicate effectively and elicit information and to translate that information to others. Ability to facilitate communication with patients, their family members, and other healthcare professionals. So put in the chat if you think this is functional or organic. Remember, organic is bad in this case. Taking a peek, I'm watching. Okay. Yeah, great job. Now think back to what we said about organic versus functional technical standards. thinking about your examples from that slide, you guys are putting in your thoughts, and that is a great job. These are examples of functional technical standards and what we aspire to. You'll notice that it does say how we have to reach the goals. It doesn't say how we have to reach the goals, only that we have to communicate effectively, translate information to others, and facilitate communication. The communication domain of technical standards offers the most salient example of organic technical standards. While the ability to communicate is certainly necessary to provide healthcare, a nurse who is deaf or hard of hearing may communicate differently. While different, a deaf individual has the ability to communicate in an equivalent manner to their peers with the provision of reasonable accommodations, including sign language interpreters or assistive devices. In fact, there are multiple deaf nurses in practice, and Anne will add some videos for you to check out. This slide shows an example of inclusive versus non-inclusive technical standards related to communication. What elements of this slide do you find inclusive, and what do you think is problematic? And go ahead and share that in the chat. Good. Yeah, so terms like see, speak, and hear frequently appear in technical standards. However, these terms focus on how and are considered non-inclusive terms. Another term, right, assumes you need to physically use a hand. But today, assistive technologies have transformed how tasks can be accomplished, ensuring inclusivity for everyone, regardless of their abilities. I'm going to turn it over to Anne.
Right, great example, Brandi. Thanks for breaking it down. So now we're going to review observation. Remember that we are covering the topic relative to the common domains we see adopted by most health professions programs. Your domains may have different headings or none at all. This is just one way to review the elements of technical standards. Okay, so let's review the examples we found in this domain. This slide reads, acquire information from demonstrations and experiences in nursing courses such as lecture, group, and physical demonstrations. Acquire information from written documents and computer systems, for example, literature searches and data retrieval. Identify information presented in images from paper, slides, videos, and transparencies. Recognize and assess patient changes in mood, activity, cognition, verbal, and nonverbal communication. So now here's what I'd like you to do. In the chat, identify the verbiage that demonstrates the functional nature of these technical standards. Go ahead and put that in the chat. Good. Yes, great. Great job. Yes, and our team came up with something very similar. Acquire information and recognize and assess. Wonderful job, everyone. So now let's look at some examples in the same domain that aren't as disability inclusive. Okay, so this slide reads, the ability to see, hear, touch, smell, and distinguish colors. Hearing, must have hearing, aid permitted. To perform a physical assessment, including listening with a stethoscope for bowel sounds, heart, and lung sounds. Smell, must have normal sense of smell to detect odors indicating unsafe conditions or changing client status. So using these same skills, let's crowdsource again in the chat the terms you think point to organic technical standards. So I'll give you a few moments to do that. Good. Great. Wonderful. Great job. Yes, I'm seeing a lot of examples of terms such as see, hear, touch, smell, and distinguish colors, must have hearing, aid permitted, and then must have normal sense of smell. These all stand out. Now, here's where I have to point out something important. As Brandi previously reviewed, these technical standards were pulled from schools in the last 2 weeks. Some nursing programs are still actively promoting non-inclusive and, dare I say, discriminatory technical standards. There's a strong emphasis here on the use of senses: vision, hearing, smell, and touch. This creates the impression that students with disabilities affecting their senses do not possess the necessary skills to be nurses, and implying they are unwelcome in the program. Throughout our talk today, we'll continue to provide examples of currently practicing nurses with disabilities, highlighting the problematic nature of the standards we just discussed.
Perfect. Thank you. Sorry for the delay. I'm running PowerPoint. As we look at examples in the cognitive technical standards domain, you're going to start to see some trends. So this one states the student must possess intellectual abilities to critically think, to demonstrate both clinical and academic judgment. The student must also be able to perform mathematical calculations, reason, problem solve, analyze, synthesize, retain complex information, and use technology appropriately. In addition, the student must comprehend three-dimensional relationships and understand spatial relationships. The student must be alert and attentive during lab exercises, didactic sessions, and clinical practice. So while cognitive domains often include a lot of information that may be new to you or new to the students, let's try to pull out the terms that suggest that this is more functional than organic. So go ahead and put them in the chat. What do you think makes this lean towards functional? I think this is one of those that's not 100% functional, but leans towards it. This is really representative of what we see out there a lot. I love how much you're participating today. This is a great group. Perfect. So here's what our team pulled out. Demonstrate. So demonstrate, didn't say how, demonstrate. Perform, didn't say how, perform. Comprehend, didn't say how, just comprehend. So those are a few examples. All right, let's look at the opposite type of example. What are the organic features in this example for the cognitive domain? The student is expected to be able to listen, speak, read, write, reason, and perform mathematical functions at a level which allows the student to process and understand the materials presented in both a written and verbal format throughout his or her course of study. What terms do you think indicate a more organic slant to these technical standards? Go ahead and pop them in the chat. Speak, listen, write, write, listen. Yes, yes. You're on it. You're ready. You're ready to redo your technical standards. Karen, that was funny. The student is expected to be able to listen and speak. So we pulled out listen, speak, understand the materials presented in both written and verbal format. The verbal part is problematic here, right? Okay. I'm handing this over to our nurse on the presentation because this is oftentimes the most, the domain that is the most controversial.
Thank you, Lisa. So yeah, the motor domain is historically the domain most steeped in controversy and where considerable difference exists specialty to specialty. Nursing is most often a direct to practice specialty, whereas medicine, for example, is not. Medical students leave school and go to graduate form of training. Because of this, there are often less procedural items that are required during school and thus less physical and motor requirements needed. Even so, there are a ton of assumptions about what it takes to physically be a nurse that need to be demystified. There are nurses who are wheelchair users practicing today and at the bedside. Anne is going to put in some sample videos in the chat. There are also nurses with physical disabilities practicing at the bedside. Given this, we implore you to really question what motor skills are actually needed to enter nursing and to question your assumptions. We are going to switch things up. So let's begin with organic. Remember, in this case, organic is bad, technical standards. Here are some statements from technical standards in the past 2 weeks. This slide reads, being free of disabling or contagious disease, perform fine and gross motor skills with both hands. A handicapped applicant candidate shall not, on the basis of his or her handicap, accept those which would preclude the essential skills outlined above, be neither excluded from participation in denied the benefits of, nor be subjected to discrimination in the program. X University may require that the applicant student undergo a physical examination and/or occupational skills evaluation. As before, we invite you to place in the chat the problematic items in these technical standards. Cindy, yikes, all of it. You guys are putting in some awesome comments. Wow. Some of you are lost for words. Yes. So, great job. And so great job. Yeah. In this case, these standards, many very transparently stick out as problematic. First, being free of disabling or contagious disease is perhaps the most outwardly. Non-inclusive discriminatory standards, this is the most non-inclusive discriminatory standards we've seen yet. And at the risk of being a broken record, are current technical standards in practice. Another is perform fine and gross motor skills with both hands. Here's the reality. There are one-handed nurses in practice, and Anna is dropping not 1, but 5 videos in the chat. Now, this took 2 minutes via Google search to find these videos, and we are pretty sure with more time, we'd find more. Okay, next up, the term a handicapped applicant. This is a function of historical, outdated, and harmful language being used. If you see the term handicap, please remove it from your technical standards. Finally, there are laws that require you to treat all applicants and students the same. So the final section, university may require the applicant or student to undergo a physical exam and/or occupational skills evaluation. If only done for the disabled student, this is not keeping with best practice. So we began by looking at examples of non-inclusive language and technical standards in the motor domain. Now let's shift our focus to reviewing more inclusive alternatives. This slide reads, students should, after a reasonable period, be capable of performing a physical exam and diagnostic maneuvers. They should be able to carry out motor movements necessary for general patient care and emergency treatment. These actions require coordination of gross and fine motor skills, balance, and equilibrium. Now let's reflect on this language. What indicators show that these technical standards are functional and inclusive for students with disabilities? Go ahead and share in your chat box. Form. I love this crowdsourcing. This is awesome. Take after reasonable period. Yeah. Yeah. Great comments coming through so far. Yeah, so you guys are coming up with some of the same things we are. Perform some motor movement, provide or direct some coordination, or what we came up with as well. So great comments, and thank you guys so much for this important discussion. Now over to Lisa for our final domain.
Thanks so much, Brandi. This is such a fantastic group. So the final domain that many people use is behavioral and social attributes. This could also be ethics, behavioral and ethics. I've seen it termed a number of different things. I find this domain, though, to be the most nebulous and also at times the most important because, as you know, many of the cases that actually make it to court or that result in OCR complaints are focused on behavioral issues versus academic issues. So this is a really important domain, but you have to think about how you can measure what you're saying. So this is just a typical behavioral domain statement. Students must possess the physical and emotional health required for the application of his or her emotional abilities and the employment of sound judgment in an appropriate and prompt manner. Students must be able to function effectively under physically taxing workloads and in times of physical and mental stress. Students must display compassion, sensitivity, and concern for others and maintain professional integrity at all times. Students must be able to adapt to changing environments, display flexibility, accept and integrate constructive criticism, and learn to function cooperatively and effectively in the face of uncertainties inherent in clinical practice. This includes appropriately interacting with individuals, families, and groups from a variety of social, emotional, cultural, and intellectual backgrounds. Now, there are several things in here that I don't think are problematic at all, and I think it's important for the practice of any type of clinical work as a healthcare provider. But there are also some things in here that I think are slippery slope. So in this domain, we don't have examples for you. We didn't want to layer an example of good and bad because, quite frankly, I haven't seen one that I would say is really, really good. I've seen more that are, leaning towards bad. And some of those things include time as a construct. So must be able to quickly or must be able to in a reasonable period of time, where time is this very nebulous construct that can't really be measured in the way that it's described. So this works against students. And I would be remiss if I didn't say something about the function of professionalism as well. Professionalism, unfortunately, is being weaponized in our clinical training environments and in our clinical environments against people and certain populations of people, including people with disabilities. And so certainly it's important for all of us to maintain professionalism. However, the way professionalism is defined should be very clear to the learners, and it should not unnecessarily cause people to dress a certain way or engage in their communication in a certain way. And the most egregious thing I've seen is to not talk about their disability. And so we certainly don't want to perpetuate that. So in the chat, as your last exercise, why don't you tell me what you would want to see in the behavioral and social attributes of a nurse? What resonates with you on this slide and what offends you or gives you cause to pause, as it does for me? Great. I love that. Wonderful. Thank you all so much. You're teaching each other. You're part of our community of knowledge that we're building here with Access and Nursing. Okay, over to you, Anne.
Thanks so much, Lisa. So in keeping with the title of this webinar, Aligning Nursing Technical Standards with Disability Inclusion, we want to assist you in reviewing your technical standards to ensure that they align with the best practices in the area. We recognize that this is a process that takes time and that multiple interested parties may be needed to inform the revision. So let's talk about what's next in that process. All of the following information will be provided to you in a reference list or through resources we provide. So don't feel like you have to copy all of this down as we're talking. But the first step would be to figure out if you need to do a full review. So start by asking yourself these questions. First, do your technical standards encourage the disclosure of disability? Students may hesitate to seek accommodations if they perceive the environment as non-inclusive or hostile. It's essential to create an atmosphere where students are actively encouraged to disclose their disability and request accommodations from the outset of the program. Early disclosure is a known facilitator of success, helping to prevent last-minute requests that might arise after poor performance. Proactive communication is key in fostering this openness. Next, do your technical standards include welcoming language? The tone and wording of your technical standards play a crucial role in creating a supportive environment. Check for any language that could be perceived as a microaggression or discouraging to applicants. Positive, welcoming language around accommodations fosters early disclosure of disability. Importantly, this shift in tone does not alter legal requirements around reasonable accommodations or undue burdens. However, it signals that your institution is a safe space for open dialogue where students can engage in a meaningful and supportive interactive process with the program. Third, do your technical standards clearly outline the process for disclosing disability and requesting accommodations? It's vital that students fully understand the process for requesting accommodations. Following the Office for Civil Rights recommendations, programs should provide clear, accessible instructions to prevent misunderstandings. Ensure that students know how to request accommodations early and have the necessary information to do so. Fourth, are your technical standards free of non-inclusive and discriminatory language that could exclude people with disabilities? Avoid eligibility criteria that might unintentionally screen out individuals with disabilities. Terms such as hear, speak, or walk are often unnecessary and inappropriate in technical standards for health professions. And finally, are you able to readily locate your technical standards? If prospective students cannot find this information easily, it can send a message that they are not wanted. So if any of your answers to these questions were no, it's time to reassess your standards and align them with current best practices to promote inclusivity. And now Brandi is going to talk about who should be involved with this.
Thank you, Anne. Next, if you require review of your technical standards, ask yourself who needs to be at the table. In other words, identify key interested parties for a council or committee to review and revise technical standards. The team members should include nursing faculty who understand clinical curricula, disability resource professional. The gold standard is someone with expertise in nursing or health science disability inclusion, simulation center and laboratory curricular experts, nursing student with a disability, clinical and curricular deans, and legal. There we go. Now let's summarize what we've learned today. So here are some key takeaways. Do not use exit standards as entry standards. Focus on the abilities and skills, the what, not the how. Apply standards equally to all students. Consider alternative ways or approaches to meeting the requirements. Center accommodations in the process, ability to meet these requirements with or without reasonable accommodations. Do not conflate essential functions with technical standards. And collaborate with the Office of Disability Services and the student. Back over to Lisa.
Thanks, everybody. I am so proud of this Access in Nursing new program for the Docs with Disabilities initiative. And we have an amazing crew, and I cannot wait for you to meet all of them. Many disabled nurses, which I would add to the list that was just given as well. To help you in transitioning your technical standards to more inclusive technical standards, we've decided to run a series of workshops. These workshops will be limited to 20 to 25 people and will include breakout groups that are 4 people with a facilitator, and you'll meet more of our team at that time. Our first one will be February 26th. We'll allow an hour and a half, so we have lots of time with you. The link to register will be sent out with the follow-up announcing that the video has been posted. We also want to give you lots of resources. So certainly the Docs with Disabilities Initiative Access and Medicine program is one source of information. We have publications. We have a new nursing publication coming soon. We're very excited. It's the first of its kind. We have the book Equal Access, which, as you've been told, is now available for download. And we have a technical standards toolkit, and you will receive several resources. But there are also other great people doing work in this area. So the AACN has been phenomenal partners with us, and they have an Accommodating Students with Disabilities faculty toolkit that we'll share the link to in your resource bundle. The Josiah Macy Foundation also partnered with us to do a 3-part webinar, which looked at the overwhelming barriers and belief systems for nursing. And so we really recommend checking out those that 3-part series, where you'll see lots of disabled nurses on our panels. And that was just an excellent and really fruitful event. And then there was a question in the chat about accessible stethoscopes and those sorts of things. And our friends over at AMFL are phenomenal. I absolutely recommend them. So that's the Association of Medical Professionals with Hearing Losses. They're an incredible group. And of course, Exceptional Nurse, who's partnered with us and been a great resource. And then the National Organization of Nurses with Disabilities as well. So you have lots of resources at your fingertips. And we thank you so much. And I'm going to turn it over to Anne to bring us home.
Thank you, everyone. We are so incredibly grateful for your participation today. We will be sending you a short survey, and we kindly ask that you complete it for us. Your feedback is invaluable in helping us improve our offerings, and it's crucial for our funders to ensure we can continue providing free and accessible resources. So as a reminder, this webinar has been recorded and will be available on the Docs with Disabilities YouTube page in the coming week. A special thank you to our sponsors from AHEAD and AACN, and to the AIN group members whose contributions made this important webinar possible. And we're now going to stop the recording.